Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia. Here we go. Good morning, Dr. Mencia. We're so glad that you're
Anita.
here, and we have this beautiful woman that we've been promising our listeners to meet, and maybe you need to introduce Donna Parkins to our listening audience.
Well, Donna and I go way back. She was one of my first patients when I opened my little office. It was 1,300 square feet, the size of the office. It was kind of tiny. And Donna came to see me as a patient. And she can tell you the story how she ended up in my office.
I think that's really important.
Good morning, Donna.
Good morning, Donna. Thank you for coming. It's so sweet of you. You know, we know about a lot of Dr. Mencia's patients, but a lot of times we don't say their name, and they rarely come on the radio. So you're a treasure.
Oh, thank you. Yes. Thank you for inviting me.
So how did you find this marvelous man years ago?
I was retiring from the school board, and they put me in a COBRA program temporarily, and I knew I needed another insurance company. And there was an insurance consultant that you could contact, and you told him all the things that were right and wrong with you, and he would match you with an appropriate insurance company. And he felt that AvMed was the insurance for me. So they sent a representative out. We filled out the forms, and when she said, you have to pick out a primary doctor, and I said, I don't know any of these doctors. And she said, look, she says, we've got this new hotshot doctor coming into town. And she said, I highly recommend that you sign up with him. And that is how I became Dr. Mencia's patient.
Did you have a ponytail at the time?
Yes.
Oh, so you knew. I thought you said so.
Yeah.
So you signed up. That was great. So Dr. Mencia, so now you have this very beautiful, charming woman who is now your new patient. And she, of course, you could see she had love in her eyes and her heart immediately, but some things didn't work out so well, did they, for her?
Well, she got this little spider bite in her breast, and she said, let me swing by Dr. Mencia so he can take a look. And you were going to go away, right? You were going to go away
I was traveling.
Yeah, she was traveling. And she said, I have this little spider bite here, and I want you to take a look at it. And I put her on antibiotic. And, of course, a good diagnostician, you want to examine. You cannot just, pick in there. You have to really examine the breast, check for lymph node, do the whole procedure. And I said, let me give you the antibiotic. Go where you're going to go and come back. And then we have to do your mammogram and get things done so we can investigate even further. So we put her on antibiotic, and when she came back, we did the mammogram. The type of cancer that was in the breast is most of the time not even picked up by the mammogram because it's in the doctor's system. The doctor's system on the breast is what produces milk. And they can travel from the doctor's system to the lymph node. By the time you feel a lump, it's usually have metastasized to the lung, to the brain, So it's cancer hard to keep up with, and you have to be on top of it. So it got to the point that they used to call Donna the spider lady at the consultant and all of that. So we sent her to one of the specialists who told her.
But wait, let's go back. So what happened? So the mammogram showed some bad things?
It didn't show anything.
Didn't show anything.
I just wasn't convinced because of the way the skin looked.
You weren't convinced.
I thought we need to go in further, and I said, I need to get some tissue or something. I wasn't convinced that the mammogram report was compatible with what I was seeing. And most people, they look at the report and they stop there. That's it, And so we got a consultant that said, it looked like you have most likely this kind of cancer, and you probably have 4 months to live. And Donna came to me very sad, My staff is crying. Everybody, she can tell you the story of what happened. And I say, Donna, don't throw the towel until I throw the towel. We're going to put the best team together. We're going to put an ace team together, and we are going to fight this together. Because she was one of my first patients, I said, we're going to put a team together, and let's fight. And this was, it was 4 months, and this was how long ago now?
12 years.
12 years ago. So
wait, but you said somewhere,
cancer-free for 12 years.
So they gave you only 4 months to live when this happened? I mean, this is...
It's an extremely aggressive cancer.
It's an aggressive cancer. Yeah.
It does not show up in an ultrasound or mammography, and there's no lump. You don't know you have it till you're in stage 4A going into 4B, and there's no pain. There's nothing.
There's nothing. So, some people are lucky, they start milking a little bit of bloody milk. They come out and they go and see the doctor. But we put a great team together, and it was so aggressive that when they removed her lymph nodes, how many lymph nodes?
They removed 16 lymph nodes, and all 16 had cancer.
Or 16
there were 16 lymph nodes.
So it's an aggressive cancer. So you have to empty the whole axilla under the armpit. And all the lymph nodes, you have to pull that out because it's such an aggressive cancer. If you remove a few and leave the other there, then it's continued to spread through there. And, it's just the
bottom line is, I'm going to interrupt you, I have a medical team that is like the who's who of medicine of South Florida. And if Dr. Mencia was not the diagnostician that he is, I would be in the show today.
Yep. I've always said in our show, and I don't do it enough, it's rare to find a good diagnostician anywhere. Diagnosticians are very strange people, in a sense, because you could go to 5 other doctors and they, as you said, they just see it and they just pass on it. But there's something in your brain. I don't know what happens, but what makes you see things that other people don't see?
To me, everything have to make sense. If something contradicts what something else is saying, then something must be wrong. So, for example, I have one patient that I listen to the lungs, and on one side of the chest, he has a little bit of wheezing there. And I remember one of my professors say, when the lung is all clear, and there is only wheezing on one section of the lung, think of cancer, always think of cancer. So I sent the patient for a CAT scan because he was wheezing there. I say, don't you want to start with an X-ray? It's less invasive. I said, no, I want a CAT scan. So we ordered the CAT scan. The CAT scan came back negative. I say, I'm not convinced because the wheezing was still there. I say, I'm not convinced. I'm going to send you to one of the best pulmonologists I know of. And I want that guy to scope you and go in there and do a little lavage and give me some tissue. And if that come back negative, then we do an MRI, then we go to other things. But, I see myself now. I know it's not like a scar because scar won't make the person wheeze. I have to make sure, I have to prove myself that it is not cancer. So, and time is of the essence. Because if I tell the patient, what, we just recheck it next year. That's a year we lost time of, to fight the cancer. So I arrange everything just like we did with Donna. We make the phone call. Patricia got me the patient in with the pulmonologist. He just retired, Dr. Cooper Smith. Got him in with the pulmonologist. We scoped the patient, got some tissue out. It was cancer. We got the surgeon involved, the thoracic surgeon. We removed that portion of the lung, and all the lymph node, everything was negative. So that's when those things happen, then you feel proud to be a doctor.
So when Donna had this and they gave her 4 months, though, why did you think that, with everything that happened, why did you have such hope?
I'm going to interrupt you here. The reason that I didn't know, but they did, is my son was getting married and they were trying to keep me alive for 1 more month. I thought they were going to cure me. And the first time they called me, my team, and I said, what are the odds? And they said 50-50. And I said, don't bother, I'll be dead in 2 months. And so they said, can we take some more tests? I said, sure. And so they called me back simultaneously, the oncologist on my cell, the surgeon on my landline, and they said, we've got a shot on this. We want to try something. I said, what are the odds? They said 80-20. I said, keep talking.
And what did they try, Dr. Mencia?
We did a radical mastectomy, and then because there is absolutely no treatment for this cancer, they took the 2 strongest chemos available on the market, mixed them together, and that's what they gave me. Mm-hmm. And
you had the mastectomy.
I had the mastectomy, and I had the 2 strongest. They started giving me chemotherapy, and I was still alive after the first one. Yeah. Second one, I lost all my hair, period, on my whole body, and I made it to my son's wedding, but I was still alive. And so they kept having me come back. Well, after 6 of these treatments, I was still alive. Mm-hmm. So they then prescribed 28 rounds of radiation, 3 angles each, and I was still alive. And then all the doctors just left me alone for 6 weeks. And at the end of 6 weeks, Dr. Mencia called and he said, would you mind coming in for some blood tests? And I said, sure. And my blood test showed that there was absolutely nothing wrong with me.
Everything was perfect.
No, I have, even to this day, I have no diabetes, no cholesterol, no high blood pressure. I don't have anything, and I'm 70 years old now.
Yeah.
There is absolutely nothing wrong with me.
Thank God.
So is this one of your most famous cases?
Yes, they all are. Bill, your husband, Bill, is, everybody, that's a story. And when I had the students with me, I say, when I go into the room, I never look at the insurance. Some doctors, they look at the insurance and say, oh, this is a great insurance. It's going to pay me very well. So I'm going to devote a lot of time to that patient. This one is an HMO, so I'm just going to run in and out. Or sometimes they just stop by the door. How you doing? You doing good? Okay, bye. And I have patients that have switched to me because they say, the doctor just stopped by the door. He doesn't even look at me, don't examine me. Don't look at my number, just and walk away. I said, no. There's a way of doing medicine, practicing medicine. When I teach my staff, I say, we take care of human beings. And every person has a history behind them. I just had a new patient. He's 93 years old. And he is one of the last survivors of the Israeli war. One of the last pilot. He fought 3 or 4 times. And they knocked him down, and he got, broken hip and this and that, but he's still going. And he came to my office with a walker, and, I was telling him, I said, at the end of the visit, I said, sir, I'm honored to be your doctor. And he said to me, I research you a lot, and I am honored to be your patient.
And so is anything wrong with him?
For 93, no, he's, here and there, little sugar, little blood pressure, little prostate, but for his age, I think he's doing very well. He's doing great.
So that's really the story. That's a wonderful story for you, Donna. And do you have any...
you have to ask her the story of the tamoxifen.
Oh, that was it. See, because I don't know that story. Yeah. Yes. Tell us...
Dr. Mencia's staff asked me to be sure to say this. I was only given 4 months to live, as you know, okay? When I had all of this treatment done, the oncologist, Dr. Pereira, had said, I'm going to put you on tamoxifen for the rest of your life. So
Excuse me, and tell me, Dr. Mencia, what is tamoxifen, even though we've heard
it's
it?
It's a medication that works on the receptors of for in the breast, and it prevent those receptors from acting and propagating. So it's a cancer prevention drug. So you just keep the receptor quiet, and we use it on patients that have breast cancer to keep it under control. And we usually use it now for 5 years, and then we stop.
So this is exactly what I said to Dr. Pereira. I said most people take this for 2 to 5 years. I says, I have been taking this for 10 years now. And he said, well, I told you at the beginning you would take this the rest of your life. We just didn't think you'd live this long. When I go into the hospital, like to visit friends, and I run into my surgeon or whomever from that long ago, and they remember my name, and they always say hi. They call me their miracle baby. And they always joke. They said, we're always happy to see you, but we're always surprised to see you.
So do you think, because it's obvious I did not meet you before, but you have a splendid positive attitude.
Oh.
Do you think that also has something to do with this?
Definitely. I think two things. One is my daughter-in-law, as soon as I got out of surgery, she got me out of bed and she had me doing this little dance and singing, I'm looking good, I'm feeling good, and all my cancer cells are dead. And she told me to do this every morning and every night. I still do it, okay? And when I was going in for my last radiation treatment, that's the only time they let you go down to the room all by yourself, escorted. And I was dancing down the halls, singing, I'm looking good, I'm feeling good, and all my cancer cells are dead.
Oh, my
and
God.
the tech looked at me and he said, what are you doing? And I said, what your mouth says, your brain hears, and your body responds.
Wow, that's
And-
Wait. You say so many things. I'm trying to write as fast as I can. What was the last thing you just
what
said?
your mouth says,
What your mouth says, your brain hears,
and your body responds.
and your body responds. And yes, a positive attitude is important. Laugh at yourself. I had turbans, and I would put huge flowers all over it just so that when I walked by a mirror, I wouldn't be bummed because I don't have any hair. People came up to me crying, oh, Donna, we feel so bad. You've lost all your hair. And I'd laugh and I'd say, now I don't have to shave my legs.
You really are. You're quite a woman. The beautiful hair you have now is your hair.
Okay, the story of the hair. It took me 5 years to get my eyelashes back. It took me 7 years to get my left eyebrow, 9 years for my right eyebrow, and a little over 11 years. It's finally growing in like real hair, and Dr. Mencia will attest to this. It was originally like cheap doll hair that was coming out of my head.
Yeah.
So, yes.
Dr. Mencia, you didn't really tell me the whole truth about her. You told me she had a good story. You didn't tell me about this woman who was just absolutely Mrs. Personality.
Yes.
Thank you.
It's a great story. It's a story that you put it in black and white, put it in a book, and people will say, no, I just fixed for the book so that people can read it. And it's a true story.
I am so glad that you came here. So Donna travels a lot, and we've been waiting, and we keep calling. When can you come down and get on the radio show? And our administrator,
but the
Dan.
traveling, she used to live here. She used to live in Broward, and then she said, doctor, I'm going to relocate. So you bought a house there, right?
I built a house.
Oh,
I designed and built a
And
house.
where-
Yeah, I
where-
still
where?
live here. I still am
And
here.
where did you do it?
It's called Roseland, and it's the very northern edge of Indian River County, where the Sebastian River and the Indian River Lagoon come together, right there at the
So
border.
you have a house there, but just for like weekends, and you live here.
Well,
other
I
times?
bought it, or I built it as an investment, and then the cancer came along, and the market went down, and I couldn't leave the house sitting there empty. So I do a triangle every month between Fort Lauderdale and Roseland, and my son lives in St. Cloud. And then in between, I travel. My biggest accomplishment since the cancer is last May, I went to Costa Rica, and I climbed to the top of the Paus volcano, which is 9,000 feet.
Wow.
This is it's hard to even believe. And this will get on, we're going to, of course, put this on YouTube, and we have a picture of Donna. But Donna, you're really special. We have a lot of good people on this show, but I have to say, Dr. Mencia really knew what he was doing. So
and and I always tell my patients,
wait. And you know what? We got so caught. For people who would like to go see Dr. Mencia, and, just remember, if you've had something that's been on your body or something you don't know about, and you need a good diagnostician besides all the good stuff he does, know that we have one right here. Now, this is what you're going to do. It's Saturday today. Dr. Mencia is rushing down to his radio show, right? Rushing down to his practice at 1600 1608 East Commercial Boulevard in Fort Lauderdale. And write this number down. Remember, this is Pencil Talk Radio. It's 954-489-1345. I'm going to do that again. Tattoo it on your heart, on your body, somewhere. 954-489-1345. Now, the Boynton Beach office, is that also open today?
No,
it's not. Okay, so let's just go down to Fort Lauderdale. Now, this is really important you know this. If you can't get out, and he's one of the rare physicians that does take care of homebound patients, so there are home visits available. Remember, you can go during the week, but Saturday, he is there, and it's AGI Medical and Dental Centers, right? And let's not forget about Stonewater Med Spa.
Yes.
That's open? And
it's open.
And you're having a good time
7
with that?
7 days a week now.
7 days a week, and I've got to go for you and I ought to both go for the salt bath.
Yes.
That's what we need to do, salt bath. Let me give you a number for the Stonewater Med Spa. You want to call them, make an appointment, 954-561-8799. And when you get finished, I know you're going to feel like Donna. Donna ought to be, what she needs to do, I'm trying to put you in a business. The business should be a bottle that you have stuff inside. It's the Donna stuff. Because, a lot of people don't have what you have. No. And we don't have time. I want you back again because I want to talk about your childhood. I want to talk about who you are.
And what she's doing after the cancer.
Oh, yeah. I mean, this is a big picture, right?
Yes.
So this was just the beginning.
Thank
you. Part one.
Can I add a couple hints for those who are listening who might be going through some of the things? These are things I learned. If you're wearing a wig, it hurts. If you stick a coffee filter on your head and then put the wig on, one, it absorbs any of the perspiration because the wig is hot, helps keep the wig clean, and it doesn't hurt.
Oh.
Okay, that's a good one.
And the other thing is if you're after your surgery, you can't move your arm, you have to do exercises, and it's very, very painful. And what I did is I would go in a hot shower and have the hot water running on my arm, and sometimes I could only raise it 1/4 of an inch more, today than I did yesterday. But if you do that 2 or 3 times a day in the hot shower, the muscles are relaxed, and it makes it a little bit easier to do those exercises.
And Dr. Mencia, I'm sure, was a great psychologist for you, too, wasn't he?
Oh, I could not have gotten through this. And again, you have got to have a great team, and no matter if it's diabetes, cancer, whatever it is, you have got to take an aggressive approach because you have to demand aggressive treatment because you may not have a second chance.
Absolutely. I had a patient yesterday. I had a patient that came in for his second follow-up, and the sugar is high, and he has diabetes. And I say, I'm going to start you on medication. Then I'm going to have you see my diabetic specialist, who is an endocrinologist. You're going to see him. You're going to see my dietitian. We're going to run some more blood tests. And he said, but you make it sound so serious. A lot of people walk around with diabetes. They don't have to do all of those things. I said, well, a lot of people with diabetes end up being blind, losing their kidney, losing a leg. And I'm not going there. In my watch, no, I'm going to cure your diabetes. We're going to take care of this thing.
The stories are so, over and over. We hear this from Dr. Mencia's patients. And I think it's the love. And, of course, that he hugs everybody when they come in.
Oh, definitely.
If you bring your dog, he hugs the dog, too. I mean, he is fearless. He really is fearless. And we all appreciate him so much. He's been doing this radio show for many years. And it's really the highlight of my life, but it's the highlight of people who listen. Dr. Andy's show. So he's, over the years, we've discussed so many things from sex to serious things, people passing away. But and I know we have to go, but you do have this wonderful gynecologist now. Wrote a great article. Decreased estrogen can lead to vaginal discomfort and pain with intercourse. People never talk about those things.
Yes.
She wrote this fabulous article, and I'm so glad you now have a gynecologist on your staff.
We are growing 1 inch at a time, but we are growing.
1 inch at a time. Now that's
a little there.
Okay. Thank you, Dr.
Donna.
Mencia.
Donna,
And
thank you for coming.
Donna.
Thank you for inviting
And
me.
we're booking you again.
And I know,
Definitely. This was fun.
I know you're touching a lot of people
Yeah.
out there
Thank you.
now. This
I
way,
try to. Yes.
This way you magnify it. So thank you for coming.
I mean, I'm touched. I can't believe the things that you've said, and that you're so charming and so effervescent. See, we feel the energy in this room. That's what we're feeling from you. So thank you very much. We'll be back with our next guest. Just stay with us. Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.